let's talk about prostate cancer. Anybody interested in that kind of stuff? It's highly common. Okay, a lot of people will get it actually. Always go to your doctor. Get your PSA checked every year. It's highly curable, highly treatable. You'll be in remission in no time, no big deal. It's just that the treatment, radiation is better than prostatectomy, just so you know. So if somebody tells you, hey, you just take your whole prostate out and you have no problems. Because, you know, that's where the cancer is. It's not true. It is not true. Well, it's dependent upon where your cancer is for sure, but... So, treatment plan is... One, hormone therapy lowers your testosterone, which feeds prostate cancer. Second is brachytherapies, radiation seeds we implant into your prostate to kill cancer and emit a radiation. And the third one is external radiation beam therapy, which targets your prostate and the cancer with radiation. Hormone replacement therapy. If you lower your testosterone to basically nil, like less than 10, then you gain fatty weight really fast. You have low libido, so you don't even want to have sex. And then you gain fatty weight, so you really have to, and you have fatigue, right? So you really have to exercise and do weight training and aerobics to combat that. Yeah, so if you can avoid it, like if your cancer's not aggressive enough, you don't really need a hormone therapy, or your prostate is not big enough, you don't really need it. So you'll be fine. So catch it early, then you'll be fine. It applies to everybody because we all know male figures in our lives. So it applies to everybody who knows men in general, right? So it's a very good public service announcement. I think on one, I just gotta... Like, if you have BRCA2, it's actually an indication of a lot of cancers. Like breast cancer, skin cancer, pancreatic cancer, prostate cancer. You know, it's not just breast cancer like we hear usually, yeah? One cancer that kills the most people is actually lung cancer. And about 80 to 90% of lung cancer is caused by smoking. One of the scariest is lung cancer, but, right, because it kills, like, you know, but it's something you can control. Something you can control, hopefully, if you don't have, like, secondhand smoke or stuff like that. You can control it because if you don't smoke cigarettes, vaping, marijuana, you know, stuff like that, you're totally fine. Yeah, you know, they're a little... you might get it because of secondhand smoke, or, you know, if you work like the construction or in the pollution, air pollution, you know. But hopefully you're fine. So that's the comforting part. That's the comforting part, right? But then, I'm gonna tell you though. I'm gonna tell you, that is what it is. But then even people with lung cancer, they still don't want to quit. They still don't want to quit. Ask me why? I don't know. We started them treatment for radiation and stuff, and they're still smoking. They're still smoking. Sometimes maybe they'll quit for like a, you know, once they're newly diagnosed and they're like, oh no, maybe they'll quit for a bit, but it's hard to maintain. I think skin cancer and lung cancer is the scariest because there's a threshold, and once you meet that threshold and you start developing tumors, then it's hard to maintain. It's hard to maintain, like especially skin cancer. It can show up anywhere, right? Like once you have that enough sun exposure, and that's enough to, you got sun damage, it's enough to have some tumor growth. Then it'll just appear. It'll just appear left and right, and you're like, you can't even tell. You know, like, it could be under your chin, it could be on your hairline, it could be anywhere really, and it's just it's hard. It's hard. Yeah. That's the scary part, yeah, because there's the threshold. So, and like for the lungs, it can recover, but let's say you quit smoking 25 years ago, then it's still, you're still at higher risk. You're like 4 times higher risk than somebody who's a non-smoker to develop lung cancer. Even though you quit 25 years ago, that's a very long time, right? You're like, oh, did you used to smoke? Oh yeah, a long time ago. I quit like it's a long time ago. Yeah, how long ago though? It's still significant. It is still important. 25 years, yeah, it still counts. Like 30 years, maybe you can get away with it because the lungs do recover, but still, you're still at higher risk. That is why. That's why when people say like, "Oh, why don't you want to try these things? How would you know you don't like it if you don't try it?" I'm like, "Yeah, I don't need to try it to know that it's bad for me." you know? Oh my goodness, people. They can just like justify all these things. Oh, I was talking to the doctor about like liver failure because we have a patient who his cancer has metastasized to the liver, and now he's like he has liver failure, and it's impacting different organs and stuff like that. So I'm like, oh, is he not a candidate for liver transplant, right? Because you hear that you can have like partial liver transplant, right? You're like, oh yeah, somebody's gonna donate a sliver of their liver, and it's gonna be totally fine. You're gonna be totally fine. It's not true actually, because we have no capability. Supposedly, according to him, we have no capabilities of actually putting in a partial liver. So you actually have to get a full liver from somebody to get it done, right? So you still have to get it from somebody, the full liver, even though you're just using partial of it, right? And you have to actually be to actually be a candidate, you have to have no malignancies. Like if you have metastases, then there's no point because the liver's just gonna die, right? Because it can't keep up with the amount of disease you have in your body. Yeah, and then you have to have like uh life expectancy of about 10 years. If you have less than that, you're not a good candidate for liver transplant. It's very interesting, actually. Yeah, so by that point, you just have no hope, right? You're just like counting the days you have left and like telling your loved ones, all kind of stuff. The saddest thing you hear is if the family still have hope and they want to keep fighting, and yet you got nothing else left to offer. Like they're not a candidate for any other treatments that you have currently, because their disease is like so extensive. Then that is the saddest thing, right? Like you hear people who are like, oh, I'm so old, like it's fine. I have lived a full life, those kind of people, they're like totally fine with whatever. Um, there are those people who still want to fight, even though like they're old. The thing I've learned a lot is that even though I know this because my grandpa passed away last year, right? And he passed away at like the age of 86, and he didn't seek treatment for his prostate cancer, and he was like stage 4, malignant. It spread to the bones and stuff like that, because they caught it really late because he didn't like going to the doctor for annual physical and stuff like that. So if you caught it fast enough, like early enough, you're supposed to get your PSA done annually, right? Then you would know that this is the huge marker. If it's higher than 4, higher than, it is abnormal. Higher than 10 is really aggressive. Then you can get the scans. We do a CT scan. We need a bone scan. We do a biopsy. We do an MRI sometimes, and that would inform if you have prostate cancer, and then you can treat right away, right? You can treat with the hormone therapy if you need it, if it's aggressive enough, and then you have radiation, and you have the brachytherapy. Don't go prostatectomy; it's not really helpful if you have aggressive cancer, right? So these kinds of things, you know, you hear from people like, oh, I'm old enough, like my grandpa would tell you, oh, I'm so old, I'm dying already, no need for treatment, kind of thing. That it's not true. We treated just this year alone, oh, of course this year, we treated somebody who's 104 years old. 104 years old. He doesn't It's a she, and she had like a mass on her, inguinal mass, right? It's like mass on her groin and stuff like that. She's 104 years old, and even then she was like living independently, before the mass has grown enough that it's impeding her mobility. But before that, she was cooking by herself, she was living by herself, and she was highly independent. And it's just that her cancer has progressed that that was the pain in her leg that was impeding her independence. So it's not really true when you hear people say, "Oh, I'm old enough that um, that I don't have to seek treatment." I mean, sometimes, yeah. If your cancer is slow growing, that it's not that your death is not gonna be caused by a cancer, then you're totally fine, right? Like prostate is like that. Sometimes it's slow growing. Like um, we can control it for 2.5 years just for home with hormone therapy, and if you kind of like die before then of other causes, then it's fine, you know. But if you treated it and you live another 10 years and you didn't die of prostate cancer, then good on you. So that's just something that's important to keep in mind because like especially our parents, like as they get older, they're always like, "Oh no," they have this kind of notion that, "Oh, we're so old, right? We can just die now. We don't have to seek treatment." That's not the reality of it, right? Because we're treating patients at like 86, 90s, late 90s, and it's totally fine. As long as it's not like, we're not gonna have you go under the knife or anything. It's not, it's just radiation, so it's fine. It's not like we're gonna tell you to go surgery and stuff like that. And yeah, it's riskier. It is riskier because of the general anesthesia. You could not recover and stuff like that. Yeah, in terms of that.